All right. Well, I will get started here and be pretty quick in my introduction, but thank you so much to everyone for joining our webinar, Building Support for WIC, Opportunities for Philanthropic Advocacy, co-hosted by SAFSF and Grantmakers in Health. Thank you so much to Grantmakers in Health for collaboration on this webinar. So I'm going to start by doing our land acknowledgement, and then I'll give a brief overview of sort of the overview for the call today, or the structure of the call today. So as funders and advocates working to create a more equitable U.S. agriculture and food system, SAFSF believes it is imperative for us to acknowledge that the roots of today's inequities lie deep in the history of land theft and dispossession from Indigenous communities. I am based in Seattle, Washington, on Cayuse, Umatilla, Walla Walla, Duwamish, and Suquamish land. As you introduce yourselves in the chat, we encourage you to acknowledge the traditional Indigenous inhabitants of the land you are on and learn more about that history. You can find maps and more resources about the land you're on at the links that I'm about to plug into the chat. And yeah, so again, thank you so much to everyone that maybe just joined and missed that brief introduction. But we are very excited to have a variety of fantastic speakers today from several different organizations. So the call today is going to be structured first with a presentation by the Center and Budget on Policy Priorities. And then we will move into a panel discussion with three very fantastic speakers who I'm not going to introduce right now. I'm going to let them introduce themselves as we go forward here. And then we'll have time for a question and answer after that panel finishes. So if you do have any questions, please feel free to pop those in the chat as we go here, or raise your hand and come off mute, and we can have a little bit of engaged dialogue after that panel. And yeah, before we get started, I'll pass it to you, Colin, really quick, if you want to say anything from GIH.
Oh, absolutely. Well, thank you, Maggie. You've done yeoman's work really putting this excellent call together. For those of you who don't know me, I'm Colin Pecker. I'm a program director here at Grantmakers in Health. And we are just really excited to be co-hosting this important topic and discussion today. It's certainly an issue a number of health funders have been engaged in for quite some time. And so we're thrilled to be able to bring sustainable ag and food systems funders with health grant makers to discuss these issues. And hopefully this will be a terrific precursor for those of you who are joining us here in Washington, D.C. on November 1st through 3rd for our fall forum, which is going to feature a number of discussions around food as medicine and nutrition. But with that, Maggie, I will turn it back over to you to kick us off.
Fantastic. And Ty, I will pass it to you. We're just doing a bit of hot potato here. And Zoe to give us a bit of an introduction to WIC and the center.
Thanks, Maggie. Good afternoon, everyone. This is like such a big time for WIC, right? Like, so I'm so glad we're doing this. It's right on time, and we're in a good, I don't know, kind of good place temporarily. Anyway, we'll talk about it in a minute. So my name is Ty Jones Cox. I use she, her pronouns, and I'm the vice president of the food assistance team at the Center on Budget and Policy Priorities, I'll say CBPP. And it's a nonpartisan research and policy institute, and we're based in Washington, D.C., which is the original land of the Anacostan and Piscataway tribes, just adding to the land acknowledgements. I came to this work starting off as a legal aid attorney in Virginia, where I kind of provided representation to whatever came in on my intake day. And so voice to really giving representation and voice to low and moderate income families that were in really tough situations. So this fits in with one of the goals of CBPP, which is to make the voices of low and moderate income people be heard in federal and state policy debates, and that the decisions that affect their lives, their health, their financial security, and their access to opportunity. And so we do that by lending our capacity and expertise to the work of building a strong, progressive ecosystem, one that centers the people and communities most affected. It expands the pathways for them to engage in these debates directly and effectively, and helps drive policy change. We work at a really critical intersection of federal work and state work, and pretty much in all of the areas that we work on. So the food assistance team specifically, we focus on SNAP, WIC, and school meals. Our WIC work focuses on funding, access, program integrity. And Zoe, who I'm going to turn it over to now, pretty much encompasses our WIC work. She is the only expert on our team who doesn't focus on SNAP. So most of the great papers you read about WIC, Zoe wrote them, or Zoe told someone and we wrote it. So I'm going to turn it over to Zoe now to introduce herself and to talk about WIC.
Thank you so much, Ty. I'm so glad to be able to join everyone today. My role is to introduce the WIC program, and some of this will probably be repetitive for some of you, but hopefully give everybody a grounding to start from for the later conversation. So I will dive right in. I'm going to spend about 15 minutes. You can go to the next slide, talking about the basics of how the program works, what we know about how incredibly effective it is, the recent trends in participation, and then give you an overview of WIC funding. So let me start with the basics. WIC is a program that serves pregnant and postpartum people, infants, and children under 5. Certification periods typically last a year or the duration of pregnancy, except that for postpartum people who aren't breastfeeding, they're 6 months. When it comes to eligibility, anyone who is in one of those categories and receiving Medicaid, SNAP, or TANF cash assistance is automatically income eligible for WIC, and about 3/4 of applicants are participating in one of those programs and is eligible that way. For other households, they have to have a gross income under 185% of poverty to be income eligible. In addition, families must be at nutrition risk, and there is a nutrition risk assessment that's part of the eligibility determination process. But as a practical matter, that doesn't weed anybody out because everyone at these income levels fall into one of the nutrition risk criteria. In addition, it's important to know that WIC does not have any immigration-related criteria, so anyone can participate regardless of their immigration status. Now I want to say a little bit about what WIC provides. As you may be aware, it provides a science-based package of foods that's meant to provide foods that tend to be lacking in the diets of low-income pregnant people and young children who participate. The foods are based on recommendations from the National Academies of Sciences, Engineering, and Medicine. And for most of the benefit, recipients get a specific type and quantity of food. So for example, they might get a gallon of 1% milk or 2 pounds of whole wheat bread. In addition to that, there is a cash-like benefit for fruits and vegetables, referred to as the cash value benefit or CVB. That was put in place in 2009 at relatively low levels, about $9 a month for children, $11 a month for adults. In about 2 years ago, initially as part of the COVID response, but then extended, that benefit was increased quite substantially. So it's now $25 a month for children and $44, $49 a month for adults. It's also important to know that WIC is authorized under the Child Nutrition Act. That's different legislation than the legislation that authorizes SNAP, and so it is not being reauthorized as part of the current Farm Bill legislative process, which you may have heard something about. In fact, WIC has not been reauthorized since 2010, when it was reauthorized as part of the Healthy Hunger-Free Kids Act. And as a result of the lag, there are some pretty basic program rules that are overdue for being updated. So let's turn, oh, you're already ahead of me at the next slide. That's great. There is a really long and robust body of research that shows how effective WIC is in terms of improving nutrition, health, and developmental outcomes. WIC participation during pregnancy is associated with a reduced risk of low birth weight, prematurity, and infant mortality. And a couple of studies have found that the gains in infant mortality were especially striking for Black participants, which is important in light of the stark disparities in outcomes. Low-income children participating in WIC are more likely to receive preventive medical care than other low-income children, and in fact are just as likely to be immunized as more affluent children, which is quite an accomplishment. And children whose mothers participate in WIC while pregnant score higher on assessments of mental development as toddlers and later on reading assessments while in school. There's a lot written about these findings, so I won't say more about it now, but happy to point people to resources. Despite this tremendous evidence of how effective WIC is. Our main concern in recent years is that it has been woefully underutilized. And that's what I'm going to explain with the information on this next slide. So every year, USDA, which oversees the program, develops an estimate of the share of eligible people who are actually participating. In other programs, this might be known as a participation rate or a take-up rate. In WIC, it is referred to as the coverage rate. And I think the main takeaway from this slide is that if you look at the most recent year that we have these estimates for, 2020, only half of eligible people were participating. That's down from where it was a little bit higher at its peak in 2011. You can see there's a break in the series because USDA changed their methodology, but before the break, there was a downward trend. After the break, there was a downward trend, both of which are concerning. And a lot of our work in recent years has gone into trying to reverse this trend. One thing that does not show up in this chart, again, there's lots of USDA information on this that I won't get into, but is that there is very wide variation across states. The coverage rate in states ranges from 36% to 65%. And so if you're interested in a particular state, it's important to delve in and find out more about what's going on there. Next slide, please. Another area that USDA looks at when they develop these estimates is take-up by race. And what they have found is that eligible people who are Latino or Black are more likely to participate in WIC than eligible people who are white or of other races. And this means that WIC may already be playing a role in reducing disparities, but also that if these rates could be increased, it could potentially play more of a role. I think it's important to note that even though Black and Latino families are participating at higher rates, if you look at where they are, still more than a third of eligible people are not participating in WIC. So there is a lot of room for growth there. That's quite important. USDA also looks at take-up by participant categories. So you can see that take-up by infants is relatively high, much more comparable to other means-tested programs. And one reason for that is likely that WIC provides infant formula, which is the most expensive item the program provides. Our main concern when we look at this data broken down by category is the low take-up by pregnant people, less than half, and by children over age 1. Across all children age 1 to 4, take-up is about 41%. You can see that it declines substantially as children get closer to their 5th birthdays. Now, in response to the low take-up rates and concern about there have been very concerted federal and state efforts to reach more of the eligible families in recent years. There have been a lot of efforts to modernize how services are provided. That was going on before COVID. Some of the changes that were necessitated by COVID, like providing services remotely and providing participants ways to communicate electronically with WIC, have jump-started that process, but it is ongoing. As I mentioned, the fruit and vegetable benefit was increased quite substantially a couple of years ago, and there have been ongoing efforts to improve the shopping experience, what it is like to actually take your WIC benefit card and try to find the foods that you've been given at the grocery store. And that work includes piloting online shopping, which by and large has not been available in WIC. Now, we don't have coverage data, that take-up data that's more recent than 2020, but we do have participation data, and that's what you're seeing in this next slide. And the good news on the participation front is that it is finally increasing. But let me walk you through the pattern. Participation had been declining. This chart starts at 2019, at the beginning of fiscal year 2019, but it had been declining before that. And you see the end of that decline. When COVID set in, there was an increase that lasted for about a year, but then tapered off. But then starting in about mid-2021, participation has been steadily increasing. We don't know if it's increasing as a share of eligible families, but it has been increasing. The increase was kind of slow and steady for a while, and then starting about 6 months ago, increased rather rapidly. So you can see a slight higher slope in the line toward the right of the screen. And I think there are several factors that are likely to be contributing to that. In addition to the modernization, which I see as very positive changes that I talked about a moment ago, there are some changes that are more concerning. families were losing the temporary COVID-related benefits that they had been receiving for a while, things like the child tax credit or enhanced child tax credit or SNAP emergency allotments. We know that there was an increase in child poverty in 2022, a very stark increase. And we also know that food prices were going up. And typically in the past, when food prices go up and families are having a harder time affording groceries, WIC participation goes up as well. So one thing that doesn't show up in this chart, but that is very heartening, is that the biggest increase in participation in the last couple of years has been amongst pregnant people, where participation increased by about 16%. And there's also been a robust, about an 88% increase in participation by children aged 1 to 4. So we are seeing progress in those categories that I said we're most concerned about. So in light of the higher participation and increased food prices, WIC needs more money than it has needed in a while. And so in recent years, there hasn't been a lot of discussion of WIC funding, but there is quite a lot right now, and it's very important. So I'm going to walk you through sort of how the funding works and what is going on right now. WIC is what is known as a discretionary program. It is not an entitlement program. So an entitlement program works like school meals or Medicaid. If you qualify, you automatically get benefits. That is not the case with WIC. People get benefits as long as there is enough money. For the first 20 years or so of the program, starting in the 70s, funding was the limiting factor. States maintained waiting lists and only a portion of eligible families could be served. However, and that in theory, that could still happen, but it hasn't, because there has been a very rare bipartisan commitment for more than 25 years to providing what is referred to as full funding of WIC. And what that means is that Congress every year through the appropriations process tries to provide enough funding so that nobody who's eligible gets turned away for lack of resources. So there haven't been waiting lists, there haven't been people turned away. In recent years, WIC has received about $6 billion annually. And in some years when participation was declining and food costs were steady, there was actually funding available at the end of the year that Congress could take back without having any impact on the program. But that has changed dramatically in the last year. It changed gradually with the program growing and returning less money at the end of the years. And now WIC actually needs substantially more. As I said, it's been roughly a $6 billion program. It now needs just over $7 billion for the coming fiscal year to be able to maintain that commitment to serving everyone eligible who applies. And it is unclear at this point if that funding will be forthcoming. Before I say a little bit more about the current threats, I just wanted to explain that WIC is extremely cost effective, especially on the food front. WIC obtains infant formula through a competitive bidding process where infant formula manufacturers provide very substantial discounts on the price of formula. And in large part as a result of that and sound stewardship of funds, while WIC food costs over many years have increased much more slowly than inflation. So it's a good investment. That said, let me turn to the current threats. There's a lot going on, and so I'm going to take them one at a time. We were very worried that there would be a federal shutdown for many reasons. WIC was one of them. WIC would have a limited amount of funds in a shutdown, but not enough to last very long. There, as you're probably aware, government didn't shut down. There's what's known as a continuing resolution in place right now, which is a temporary funding measure. It is possible that when that expires in mid-November, there will be a shutdown. Again, WIC would have funding. Fortunately, by November, there would be more funding for various reasons available to states to last for a longer shutdown. But if it went on for a while, WIC could run out of money. Under a continuing resolution, which is what's in place now, programs typically get exactly what they got in the prior year. Because of the increases in participation in food costs in WIC, that wouldn't be enough. But WIC was singled out and got special treatment that essentially says the program can spend at the level needed to maintain current operations. So states have not had to scale back their programs and there's been no benefit cut right now. So we're, as Ty was saying, we're kind of temporarily in a good place. But the big question is what funding will be provided for the year. And the timing of the increase in costs was such that when the administration first put together their estimate of what would be needed, which was published in the president's budget in the spring, their estimate ended up being way too low for what's needed. And as a result, the legislation in Congress is also too low. So the Senate has a bill pending that matched the administration's request, which at the time the bill was first developed looked like it would be enough, but it's very clear now it wouldn't be. By our estimates, if the funding level in that bill became law, 600,000 eligible new parents, toddlers, and preschoolers would have to be turned away from WIC. There's a bill pending in the House that would have the same effect in terms of turning people away, but would also slash the fruit and vegetable benefit that I mentioned almost back to where it was before the recent increase, and that would affect 4.7 million participants. So this chart is showing you, just to illustrate, it's the participation timeline you saw before. And then the little dashed black line at the right-hand side is the participation level that could be supported by the pending legislation. So you can see that's well below where participation is now and well below our estimates for the coming year. The administration has estimated that WIC needs about 800 million above this funding level in the Senate bill to continue to serve all eligible applicants without cutting benefits. So that is why there is a lot of attention on funding right now. We hope you'll be able to engage in those conversations. And with that, I will let you hear from some other of the wonderful panelists lined up.
Fantastic. Thank you so much, Zoe. And yeah, thank you to Holly for sharing those slides. So yeah, now, and I should remind everyone, if you do have any questions, please drop those in the chat and we'll have time to answer them at the end. But now I'm going to turn it over to you, Monica, Georgia, Soliana, and Zoe for a panel discussion.
Thank you so much. So good morning or afternoon, depending on where you are. My name is Monica Beltran, and I am responsible for WK Kellogg Foundation's maternal and child health portfolio, which includes investments to ensure that infants are born alive and healthy, and that women are able to exclusively breastfeed for at least 6 months. It is an honor to be in community with you today, with our panelists, with Georgia and Soliana, whose work has been extremely important in the health and well-being of children and families. I also want to express my gratitude to the Sustainable Agriculture and Food Systems Funders and the GIH for putting this panel together. I'm already learning a lot. And with that, it is my pleasure to invite Dr. Georgia from the National WIC Association and Ms. Soliana Massa to the stage. So I'll start with you, Georgia. If you could introduce yourself, tell us about your organization and what brought you personally to the work.
Absolutely. I want to first start by just thanking you for the invitation, for being here today. It's lovely to be with my colleagues and be with you, Monica. And it's nice to have the opportunity to share our work on WIC with some new folks. So I'm Georgia Machel. I'm the current interim president and CEO of the National WIC Association. The National WIC Association is a nonprofit organization that essentially represents the voices of the folks who work within the WIC program to policymakers. We also provide education and resources to our members. And we also drive research and innovation in the WIC space, which has been a very exciting space to be in the last few years, because there's just been so much happening. So yeah, we represent state and local WIC agencies. They're our primary members. The way that we convene folks is through conferences. So we do 3 large conferences every year, which is an opportunity for folks to come together and share the work that they're doing. And those are really critical spaces for people to get a kind of landscape kind of overview of what's happening within the program across the country. Zoe mentioned that programs differ vastly from state to state. That is very, 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 very true. And, you know, as the folks who represent those states, we hear from our members regularly and have to kind of make sense of what this means for the program on a national scale when we hear about things that are happening in specific states or in specific local areas. As an organization, we also rely heavily on our partners. So we work really closely with both the Center and 1000 Days. One of the approaches that we have to advocacy is combining data and stories. And I think this is a great group of people to kind of represent that approach, because we frequently draw on the research and data that Zoe and her team kind of develop and put together. And we've definitely relied heavily on the stories and the lived experiences that 1000 Days have been able to kind of elevate and put together over the years as well. So that's something that's really important to us. We also are really passionate about building advocacy capacity. I think there's often a kind of concern around what advocacy is and the difference between advocacy and lobbying. And obviously, as we work very closely with state agencies, they cannot lobby, but they can become advocates. And so a lot of the work that we do is around training our members to be advocates. And we always lead with the fact that policymakers would rather hear from people who are working directly in the program than hear from us. And so that's really powerful when we're able to kind of bring people to DC or kind of lead opportunities for folks to be able to share their experience. So that is a kind of overview of who the National WIC Association is. In terms of what brought me to this work, well, I guess a long time ago now, I did a PhD in food policy in the UK at City University of London, and my focus was on looking at the kind of policy origins for the UK's equivalent to WIC, which is called Healthy Start. And at that time, there was very little research on this program. And so naturally, I ended up looking to the literature on WIC and was absolutely astounded that there was so much literature and so much data on this program, and just really interested in the fact that there was a really strong connection between research, policy, and practice. And as someone who was in academia, but was very much intent on working in a kind of real life policy space, it was just really heartening to me to see how this area of work really lived these connections between research, policy, and practice. And so I was very drawn to looking at WIC and found myself very grateful for the opportunity to join the National WIC Association as their research and evaluation manager about 9 years ago. So yeah, that's how I got here.
Thank you, Soliana.
Great, and just echoing Georgia, really grateful for the opportunity to be here with all of you today to discuss, some of our policy and advocacy work and communications work focused on WIC. So a little bit about myself. My name is Soliana Maaza, and I'm the Policy and Advocacy Director at 1000 Days, but currently I'm the acting Initiative Director. We are an initiative of FHI 360, which is a larger global organization that partners closely with the US government. If you're unfamiliar, the 1000-day window is a foundational period from pregnancy to 2 years of age, where we focus in on, obviously, at 1000 days, investments and prioritizing this pivotal window really sets up families and children and really societies for success. At 1000 Days, we primarily work in the policy and advocacy space as well as the strategic communication space. So on the policy and advocacy front, unlike Georgia and some of the other organizations that you guys might fund or work with, we don't work at the state level, and we're not a grassroots organization. So, our team and our staff are really focused on the best ways that we can help to kind of, become informed by these, direct implementers and, direct people that are living the experiences as program participants, and kind of push the federal government to kind of create policies and obviously provide funding levels that support programs like WIC. We also have a really deep presence on social media, and Georgia had mentioned some of our storytelling capabilities earlier. And we work with our strategic communications team to work directly and reach out directly to some of the stakeholders that are participating in programs like WIC, and ensure we're kind of elevating their direct experiences and stories in our policy oriented conversations with folks at Congress or folks at relevant government agencies as well. It is important that they're hearing directly from the participants and stakeholders, but it's not always feasible for those folks to kind of be always participating in these very wonky, conversations and processes around appropriations, or, we had mentioned that the Child Nutrition Act hadn't been reauthorized recently, but in those conversations as well, to ensure that their kind of best interests are represented And that's where organizations like ours and, our partners, we do work in coalition kind of across advocacy partners are really important to kind of elevating WIC, and for 1,000 Days specifically, speaking about how WIC really sets families up for success in their 1,000-day window, how it provides support for, people within pregnancy, how it provides support to, infants and toddlers as we're kind of introducing complementary feeding, as mothers are focused in on breastfeeding and they need to get additional nutritional food and resources and calories. And, that's a little bit about why we're kind of really focused in on WIC and, obviously big fans of WIC. And we also do, I know we kind of spoke a little earlier about the differences between advocacy and lobbying. While I spend most of my time in the advocacy world, and I'm a big advocate for WIC and a proponent of educating folks on the services that they provide, I'm also able to spend a portion of my time focused in on that direct lobbying. So Zoe spoke earlier about kind of the funding levels and the needs for WIC. So for organizations like us that are able to lobby, we're able to kind of directly enter into those conversations to, help influence things like appropriations. And, that's the big kind of difference between advocacy and lobbying, right? Advocacy is more so focused on education and the uplifting of a topic, where lobbying is really influencing that direct kind of budget line item or specific policy that we're trying to push. And then I think the last question is what brought me to this work. So actually, most of my career has been focused in the global health space, and I've worked a lot on kind of different international programs. I worked at USAID and at other private foundations that are focused on improving global nutrition in U.S. foreign assistance. And I think like a lot of folks that kind of worked in the global health space, maybe 4 or 5 years ago, I felt very motivated. I was always so focused on improving lives of folks abroad and livelihoods of families abroad. But I felt really kind of moved and kind of captured by all of the different things happening within the United States. And I felt that, I could take some of my lessons learned and policy expertise and try to apply that on a domestic front as well. So I think that's why, 1,000 Days was appealing for me, because we actually do work across global and domestic. And it's very interesting to me how, each side kind of can inform each other, things that we've done globally in our work and how that informs the domestic agenda as well. So I would say, that was a big motivating factor for me to try and, not only think about nutrition globally, but also think about how can we improve nutrition and support the 1,000-day window within a domestic portfolio as well.
Thank you so much, you both. So Georgia, I think that you and I are pandemic partners. We've met over the pandemic, and I love this question because we have talked about this a lot. But what are some of the lessons learned from the pandemic that should continue in the WIC implementation going forward?
Yeah, I love this question. And I can't answer this question without giving the props to the WIC community who pivoted on a dime to make WIC services available remotely very, very quickly. And I think one of the things that was phenomenal about that moment was, for a long period of time right before the pandemic, there have been a lot of research and a lot of focus about how do we overcome these barriers? Like, what can we do to overcome the transportation barriers? What can we do to make the program more flexible? And then boom, overnight, it was like, whoa, all of a sudden we're in this big experiment where this thing we've been wondering about for a really long time, all of a sudden was the new reality. And we got to witness how different programs responded to the challenge. And through that, we were able to really establish that, much like in the WIC food package, where the focus for many, many years has always been flexibility and choice. If you give flexibility and choice to a parent, then that gives them agency over the experience that they're having for them and their families. And when someone has agency over the experience that they're having, they're more likely to want to continue participating in something. And so, we often talk about the WIC participant journey. So how someone learns about the program all the way through to how somebody ultimately cooks the food that they purchase with their WIC food benefits. And along that journey, there are all these points where people have to get certified. They have to go to clinic for various appointments. And we've known for a long time that that's been really burdensome. And all of a sudden, there were these opportunities to make some services remote, to be able to do remote certifications, which meant you didn't have to bundle a family onto the bus to get to an appointment and pull someone out of daycare and request to come to work late so that you could make sure you got to your WIC appointment so that you could get certified or recertified or whatever the appointment was for. And so those kinds of flexibilities that were able to be established throughout the pandemic were really, really crucial. Another big piece that's come out of there, and I should also share that 2 weeks ago, we hosted our WIC Technology Conference, which we do every 2 years. And typically that conference has been very much focused on using EBT cards and the kind of transition to EBT. But all of a sudden, this was our first in-person tech conference post-pandemic. It was incredible to see like the range of innovative practices that folks have been actually able to implement and run with and evaluate and now share because of the flexibilities that were put in place. So online ordering for WIC foods was another one that really got a lot of focus and attention in the pandemic, I think because the SNAP program was ahead of us in terms of rolling out their pilots for online ordering. And we started seeing these weird phenomenons where, you know, WIC participation was going up, but redemption of WIC foods was going down. And we were trying to figure out what was going on there. And we were kind of looking at the states where the SNAP pilots were happening and wondering, you know, is the fact that people can't order their WIC foods online having an impact there? So ultimately, in a nutshell, my response to that question is flexibility and choice in terms of how people access the program and how people use their benefits, I think is like the main takeaway and what we need to like retain post-pandemic.
Thank you, Georgia. And Soli, what is 1000 Days Advocacy Agenda and how does it relate to WIC specifically? And I want to underscore that we just averted a government shutdown, which would have been terrible for WIC. And we might be facing another one, in like 45 days or less?
Yeah, happy to speak to that. So 1000 days, again, you know, I spoke about the pivotal window from pregnancy to 2 years of age that we're focused on, but within that, we kind of have 3 broader buckets of work where we kind of center our focus. So the first one is nutrition, the second is community and workplace supports, and then the third is healthcare. So obviously, I think the most, WIC obviously is focused within the nutrition portion of that, but I also think it goes through in some of our other bodies of work. So within nutrition, you know, we're focused on ensuring parents and caregivers have the access to the resources and knowledge that they need for them to access good nutrition. And federal programs like WIC provide direct access to these nutritious foods for families. So, you know, it's pivotal in things like pregnancy, breastfeeding, complementary feeding, and kind of postpartum care for families to be able to access adequate nutritious foods to kind of support their different caloric needs during this 1000-day window. You know, we're also working to make good nutrition accessible for families and caregivers, which includes different kind of behavior change campaigns to increase healthy diets and improve feeding practices. So, you know, that work stream is more so focused within our strategic communications lane and obviously helping to kind of educate all of these families about their kind of eligibility and access for programs like WIC. You know, Zoe spoke earlier about some of the kind of communities that are eligible for WIC and not, taking up that eligibility and enrolling in programs and, you know, pregnant people and toddlers, you know, and toddlers would include toddlers in that 1000-day window, 1 and 2, that we'd like to see some kind of increased participation in the WIC program. So we ensure they're kind of meeting all of their different nutritional needs. I would also say, and, you know, I took some notes during Zoe's earlier presentation because it kind of got my brain thinking about our work and our advocacy priorities on WIC, but, she mentioned that there's a lot of data out there that kind of supports some of the benefits of WIC, including increased participation in things like preventative care. And I would say that's another big reason, at 1,000 Days, we're really focused on prenatal care, antenatal care, care for toddlers and babies to, avoid things like infant mortality, low birth weight. So it's really great to see that data and support that kind of WIC program helps folks enroll in that preventative care that's kind of needed throughout the life cycle, but also, really needs to be prioritized again within that 1,000-day window. And then I also mentioned earlier, for us, it's all about the kind of promotion and protection of these programs and programs like WIC. And I'll just speak very briefly to the government shutdown, which we recently avoided, but unfortunately will likely be threatened again. We're in a really interesting time for those of us that are closely following U.S. politics. I mean, we narrowly avoided a government shutdown, in the same weekend that the Speaker of the House was removed. And right now we're going through this kind of battle and placing a new speaker. But I just raised that to say that none of these things can move and none of these funding decisions can happen until those things are kind of in place and set in, right? There's not going to be an FY25 budget until we have a Speaker of the House, and a budget can move through the House and then move through the Senate and then be agreed upon and hopefully signed into law by the president. So I'll just add that, organizations like ours that are focused on, additional aspects, not always just directly speaking about WIC, kind of think about the overall health of these kind of different government processes and how we kind of encourage policymakers to, continue something as simple as passing an annual budget. We're one of the, largest economies in the world, and we do our budget annually. I can't think of a time in my lifetime that we've gotten a budget on time, unfortunately. And, unfortunately, Congress is one of the only organizations or government bodies that are able to kind of not do their job and not put a budget in place, but still continue to get paid, right? And, for some of these programs or folks implementing the programs, they don't have that same kind of luxury. We're really seeing deep negative impacts to programs and policies when we don't kind of have things happening on time and budgets in place. So I'll just add that another really big part of our support to programs like WIC and services that are provided to families in their 1,000-day window are around kind of ensuring that we can kind of get the resources allocated from Congress on time or nearly on time, in addition to ensuring that they're kind of meeting the needs of the participants. We need to make sure as a baseline that things are running smoothly, and then from there help inform policymakers on, how we can adapt these programs to meet the needs of the communities that are participating within them.
Thank you so much. So I have another question with that in mind. And so I invite you to chime in if you have anything. But what are some actions you would recommend funders to take to get involved in this space?
Sure, I'll start. And what I have to say builds very much on what Soliana and Georgia have said. I think there are 3 areas that I'd like to highlight. One is just the importance that has already been mentioned of keeping up a steady drumbeat of support for WIC, highlighting how effective the program is, how important it is. That needs to go on all the time in the background to maintain support. It is especially important now when funding is adequate funding is in question. For those who can do more specific advocacy or lobbying, I think, educating policymakers about the importance of full funding and about the importance going beyond this funding cycle of updating the program rules through reauthorization is important. There isn't an active policymaking process around reauthorization right now, but it may reemerge within the next year or two. And that will be an important opportunity for advocacy around updating the program rules. And then I think the third area that I wanted to highlight is I do think there is very widespread awareness within WIC programs and the WIC community of the need to increase take up. I don't think that has broken through outside of WIC to communities that, to stakeholders that typically engage in working on improving maternal and child health outcomes. So I think work that supports elevating WIC in conversations about maternal and child health, and building policies in Medicaid and other areas that can help to increase WIC take-up is very important. So building support amongst Medicaid agencies, healthcare providers, healthcare advocates, anti-hunger advocates, early childhood advocates, all of these are important so that WIC gets the support from outside that it needs to build and adapt going forward and reach more of the eligible families.
I would also, if I can, I would also just like add to that. I agree with everything that Zoe has just said, but I think also making sure that participant voices are part of that ongoing drumbeat. Like we really want to make sure that the lived experience of WIC participants is central to the advocacy that we're doing. And I think from our experience, we found that that's actually really powerful, both from an advocacy and also a messaging and communications perspective. Obviously, the last few weeks, hopefully it's obvious to everybody, but like the last few weeks, there's been just a lot more press around the WIC program. And we're at a point now where press are kind of like, honestly, like they'd rather talk to WIC participants, which I think is fantastic, than necessarily get the kind of, this is the mechanics of the policy piece, which is what we can provide. They're interested to know, what's the actual impact going to be on a family next week if the government shuts down? Like that's what people are interested in hearing about as well. So I think opportunities to support like WIC participants to have the same kind of advocacy opportunity trainings and opportunities to do communications trainings and things is really helpful as well.
Yeah, and I'm happy to kind of add in there, and definitely just want to reinforce both the points of Zoe and Georgia on what's needed. And, and I think another opportunity for funders would be to kind of support organizations like ours to continue the work that we're doing. Advocacy is a really interesting space to work in because unlike other technical areas, it's hard to attribute kind of direct success to one action that kind of happened within a policy or advocacy agenda. And I think because of that, it sometimes is a little squishy and it's hard for funders to kind of understand exactly what they're investing in. What's that return on investment for, an advocacy investment? So I would say for organizations like ours who are, very committed and focused in, to Georgia's point, on kind of elevating the voices of participants and ensuring that their kind of wants and needs and thoughts are pushed into these kind of wonky policy and advocacy agendas. I would say, it's important and pivotal that we have support to do that. So, things like general operating support grants that give us the kind of flexibility to kind of assess the kind of political needs and environment and kind of deploy resources in the kind of different specific areas, whether it be more strategic communications to kind of reach participants or more of that direct policy and advocacy and education work that we do. Also dollars that if you are able as a funder to support some of our lobbying work, we are very gracious at 1,000 days to be kind of afforded through some of our grants, smaller buckets of money that we can kind of use to do some of that direct lobbying. That's especially important in times right now where there are such big threats to the funding levels for WIC. So those are just a few other things that I think, in addition to Zoe and Georgia's points of what, funders like you could do to support all of us and, ultimately support these participants and support these programs that are kind of pivotal to them living happy and, thriving within life.
Thank you so much. So now is the time where we get to ask questions. So I'm going to read a question from the chat and I'm going to ask any of you to jump in. In New Mexico, we have thousands of WIC users, and they were significantly challenged during the infant formula crisis. I'm so glad this was brought up. I'm curious how WIC and other advocates are addressing some of those supply chain issues that significantly impacted families with young children so that it doesn't happen again.
Georgia, do you want to start or do you want me to?
Do you want to start and then I can kind of chime in with?
So there's a bunch of things to say.
Yeah.
There were a lot of temporary flexibilities put in place within WIC to help make sure that the formula that was available during the height of the shortage could get to WIC participants. That's one thing to say. There was a piece of legislation called the Access to Baby Formula Act that requires WIC, the contracts that WIC programs enter into with manufacturers, to have provisions that essentially say that the manufacturer will ensure that WIC participants have access to formula during shortages. I think it's an open question whether those are effective and enforceable. And then the third thing to mention is there was another piece of legislation focused on the FDA that directed the FDA to work with the National Academies of Sciences, Engineering, and Medicine on putting together a committee to make cross-government recommendations on addressing supply chain issues and access to infant formula going forward. I'm serving on that committee, and the report from that, which is due out in a little less than a year, will have recommendations that hopefully the FDA, USDA, other government agencies, and Congress will be able to act on.
Thanks for that overview, Zoe. I think the other piece of this issue is it's a massive communications issue as well. So from where we sit at the National WIC Association, typically when something unexpected happens, the question we start getting from our members is, what should we be telling participants? And that is a really difficult question to respond to when you're in parallel trying to get a sense of the lay of the land and what is actually happening. And this specific issue elevated a really important conversation for our members, which was around kind of infant feeding equity, in a sense, where, within WIC, we obviously are massively pro breastfeeding and want to help families reach their breastfeeding goals. And there's often a internal challenge when it comes to formula feeding and families that choose to formula feed. And we're now at a point where we can kind of recognize that this is actually it's kind of an implicit bias that we as a community have held for a very long time, where we prioritize breastfeeding because we know technically it's the best thing for the baby, but it also disregards the experience of the family. And so one of the things the National WIC Association did was basically a communications campaign that the goal of it was to indicate that WIC has respect for families regardless of your infant feeding choice, and that we're here to help you achieve your goals. And so part of it was around not shutting down the conversation around, well, there's no formula, so I'm not going to go to WIC. It was like, no, go to WIC and let WIC help you understand what it is that you can do, whether that's guiding you to a different formula choice or helping you to maybe start breastfeeding again, whatever it is, we want to help you. And so there was a really helpful kind of narrative shift for us as a community, which was also quite challenging, but I think important. That was kind of off the back of this specific incident that happened. I also think that, zooming out for a minute, one of the things that we have learned, or I have learned working in WIC, is that we cannot anticipate what's going to happen like week to week. Things happen and we have to be able to respond. So when it comes to the best way that folks can support from a funding perspective, funding that has flexibility for us to remain responsive to issues as they emerge and arise is really, really critical, because between COVID, between the infant formula crisis, we found ourselves in some really hairy situations that we couldn't have anticipated. And we've been able to be responsive because of the flexibility of the support that we've had. So I just wanted to kind of return to that question on the back of this one.
Oh, I was going to say, they both raised great points, and I don't have a ton to kind of add, but, obviously 1,000 days, as Georgia mentioned, kind of prioritizing families to kind of reach their breastfeeding goals is one of our highest priorities here at 1,000 days. And I think the opportunity, or, the unfortunate thing that happened with the infant kind of formula crisis helped us think thoughtfully, to Georgia's point about that kind of natural tension between breastfeeding promotion and ensuring that families have the choice that they need of how they want to kind of feed their babies. So I think for us, in responding to the infant formula crisis, we were very, very careful not to kind of have our kind of breastfeeding promotion brains come to front and center and be like, let me take this opportunity to teach you or talk to you about breastfeeding, and kind of take the opportunity from the policy side to kind of think of ways to work with the US government to say, how do we prevent this from happening again? What forecasting can be done? Who can we bring in that kind of focuses on supply chain issues, to some of the things Zoe mentioned earlier on those two specific pieces of legislation. And then it helped us kind of internally think about, how do we walk this delicate balance of kind of supporting families to reach their breastfeeding goals and respecting how everyone chooses to kind of feed their infant and child. So that was definitely something we were also really aware of and focused on. I think there were a few other kind of efforts that kind of helped us think outside of our kind of normal mechanisms for feedings. There were conversations on how do we better support and regulate things like donor milk banks and things like that. So just I think bringing the community together to solve a big problem is always something that generates really creative and new ideas, and something that kind of came out of the infant formula crisis. And we're hopeful that we won't be revisiting that anytime in the future, and that different things have been put in place now to avoid a similar situation in the years to come.
Thank you so much. Julia, I saw that you had a question, but we have 1 minute left. So if you want to say it and maybe we can follow up, if that's okay.
Yeah, I don't know that there's time for it. My two questions were, if you're a statewide funder and you can't fund at the federal level, does it make sense? We're particularly interested in trying to get more pregnant women and more older children above 1 sort of enrolled. And is it working with other state partners to fund national advocacy to change like recertification and outreach? Or is it funding pilots in your own state about like successful interventions with, OBGYN offices or, daycare centers or something like that? I guess just how to direct our money. That was one question. And then since I have you and we're at time, if anyone has any suggestions for a group that's doing a really good job mobilizing WIC participants to talk about their experiences, we're always looking for good examples. So it's a long question, but those are my thoughts. If I can follow up with anyone, that would be great.
Thank you so much. I'm going to hand it back to Maggie.
Yeah, I think, Julia, those were really fantastic questions, and this is recorded, and we can follow up. I can connect you via email actually with everyone, I think all of our panelists, and then we can go from there. But same to everyone, if you do have any additional questions, please feel free to email them to me. I can pop my email in the chat really quick, and we can go from there. My last name is long, so this is going to take me a second to type out. So I think we'll close it out there. I know folks probably have other calls to jump to, but thank you so much to our panelists today. Thank you to GIH for helping organize this really informative session. I definitely learned a lot. I've been looking forward to this particular session for a really long time. So thank you so much to everyone for joining today. Thank you for presenting today, and really looking forward to collaborating in the future. And it looks like, Soliana, you popped one quick thing in the chat, so I'll make sure I capture that. Julia, I'll connect you with everyone. And with that, I think we'll wrap there. Thank you so much and have a wonderful rest of your day.